choice. Period. There's nothing better. I wish I could say there was. There isn't. Now, how many people think morphine is a good drug after I just said that? How many people think morphine is a terrible drug? Be honest. How many people are afraid to take morphine? How many people think the guy who's just been put in jail, the physician you may have seen on 60 Minutes, 25 years in prison for prescribing lots of opiates to his patients? Problem. Why is that? Well, because morphine has side effects, lots of them. But the side effects are perfectly understandable. They're because the opiate receptor is not just where the pain control system is, it's all over the damn place. There's an area that controls breathing. It has opiate receptors. That's the reason why an overdose will kill you. You stop breathing. There's an area in the limbic system. Remember the emotional part of the brain? Well, it has opiate receptors. And that's why junkies shoot up heroin. They're not trying to get pain relief. They're trying to get a high. All right? And it makes perfectly good sense. When you feel good, maybe that's what's going on. That's a side effect when you're trying to block pain. And perhaps the worst one in the case of the clinic is constipation. How many people in the audience have had diarrhea? See, you're honest. It's very interesting. Medical students, nobody has diarrhea. It's quite amazing. Maybe only at UCSF. But if I ask that question, 2 hands go up. Anyway, suffice it to say, I'm sure they all did. How do you treat diarrhea? What do you do? Paregoric. Well, you take the good stuff. Imodium? Kaopectate, remember that? You know what that is? It's an opiate. You're taking a narcotic. But a brilliant opiate. It is designed by the drug company to be in a form where it cannot get into the central nervous system. It cannot cross the blood-brain barrier. It's stuck in the periphery, but that's where the gut is. You want to shut off the gut, and you don't want it to get into the brain. It works beautifully. All right? It's just understanding the biology. Yes, sir? Well, Pepto-Bismol works for constipation? Oh. Oh, for diarrhea. No, fair enough. You're right. You're absolutely right. I agree. Doesn't work as well as anyway, we'll talk about that later. Doesn't work for me, but I, of course, never had diarrhea either. The problem is we have all these side effects, and what are we going to do? We need to find a way to get the pain relief without the side effects. That's the goal we talked about with aspirin. It's the goal. And it turns out there is a way to do it. It's not a way you can do it with everybody, but it's very common now. It turns out that the spinal cord has lots of opiate receptors, and it's possible to inject the drug right at the level of the cord. And this is done all the time now. It was discovered by Tony Yauch in rats years ago, and within no time was adapted to humans. It was initially used, and it is used all the time for women post-C-section. I'll show you an example. It's now put in pumps for people with chronic pain. And the beauty of it is it blocks pain because it blocks the output, but it doesn't produce the side effects because it can't get to the brain. The doses are too low. You don't get constipation because it's nowhere near the gut. It's terrific. What you do is you pour the morphine epidurally around the dura. It gets into the cord, or you can use fentanyl or whatever. It seeps into the cord, and it literally shuts off the spinal cord, and it works. It's remarkable, very effective. This is a woman. I took her picture. She had a C-section 2 hours before. 2 hours before. She had epidural morphine put in. It'll last for hours because it sort of sits there. No paralysis. She can feel things, but no pain. She can take care of her baby. If you had put epidural, with the old epidural, which is really local anesthetic, you don't get off the table because it can paralyze you. It'll block everything. And if the local anesthetic gets into the fetal circulation, you got a problem. There's nothing you can do. You can wait. What happens if the morphine gets into the fetal circulation and you're worried about respiratory? What do? How do you treat it? Quickly, immediately. Naloxone, Narcan, and immediately you're back to square one. So morphine is a great drug. You got to know how to use it. What other politically sensitive approach to pain control should be considered? Yep. Okay? Absolutely, cannabis. It's just been approved in Canada for neuropathic pain. I don't know that it'll ever be approved in this country for the political reasons. Does it work? In animals, it works spectacularly. It makes sense. We understand